A gastrostomy tube, or G-tube, goes through the skin on the belly and ends in the stomach. It is also called a feeding tube. This video will help prepare you to use your child's G-tube at home. This includes clamping and unclamping the tube, flushing the tube, giving medicines through the tube, and what to do if the tube gets clogged. There are many types of G-tubes. We will focus on using a button tube with extension tube, also called an extension set. Even if your child does not have a button tube, you will still give medicine as shown in this video. Keep in mind that your home supplies may look different than those included in this video, but the process will be the same. First, let's discuss how to clamp and unclamp the tube. The clamp is this plastic piece on the tube. It is used to close the tube so nothing can go in or out. To clamp or close the tube, find the clamp, pinch it together until you hear a click. The tube is now clamped. When the clamp is closed, it will not move up or down the tube. To unclamp or open up the tube, find the clamp. Use your thumb to push up on the small piece that sticks out. The tube is now unclamped. Now you can use it to flush the tube, give medicines, or give feeds. Next, let's discuss how to flush the tube. Talk with your child's care team about when to do this. They may advise to flush before tube feeds, after tube feeds, before giving medicines, after giving medicines, or at other times. There are two openings on the end of the tube. The small opening is used for giving medicines and flushing. The large opening is for giving tube feeds and flushing. You will use a small tip syringe to flush the small opening and a large tip syringe to flush the large opening. To flush the tube using the small opening and a small tip syringe, wash your hands well or use alcohol-based gel or foam. Gather your supplies. This includes a clean, empty syringe, water, and an extension tube if your child has a button tube. Talk with your child's care team about whether to use tap water or sterile water. Ask them how much water to use. The amount depends on the age and size of your child as well as your child's condition. Fill the syringe with the advised amount of water. Make sure to prime or fill the extension tube with water before attaching it. Clamp the tube, then attach the extension tube. To do this, open the cap on the button, put the small tip on the end of the extension tube into the button, turn the extension tube so it is locked in place. Next, open the cap on the extension tube and connect the syringe. Unclamp the tube. Flush or gently push water into the tube. Clamp the tube and remove the syringe. Close the cap and remove the extension tube if advised. Clean your hands well again. Now, let's discuss how to give medicine through the tube. Wash your hands well or use alcohol-based gel or foam. Check your child's medicines. Prepare the medicines as advised by your child's care team. Gather your supplies. This includes medicines in syringes, a syringe with the right amount of water for flushing, and an extension tube if your child has a button tube. Make sure to prime or fill the extension tube with water before attaching it. Clamp the tube, then attach the extension tube. Flush the tube with water if advised. Open the small cap on the extension tube. Attach the first medicine and unclamp the tube. Give the medicine and clamp the tube again. Remove the syringe. Do this for each medicine. Ask your child's care team whether to flush between medicines. Flush the tube to ensure all the medicine gets into the stomach. Ask your child's care team how much water to use. Clamp the tube one last time and remove the extension tube if advised. Clean your hands well again. Finally, Let's discuss what to do if the G-tube gets blocked or clogged. If this happens, gently squeeze the tube between your fingers from the tip of the tube to the skin. This is called milking the tube and may help to move a blockage if it is not a button tube. Try to flush the tube with warm water. Use the smallest syringe size that you have. Gently flush the tube with brief and gentle pushes. Never force the water into the tube. Then milk the tube. If this does not work, remove the extension tube and flush with warm water. If you still cannot flush the tube, use a new extension tube. You may also use a regular syringe to flush warm water directly into the button. If none of these methods work, call your child's provider. We hope this video has helped prepare you to use your child's G-tube at home. Thank you for trusting us with your child's care.